Maria arrived for her first trauma team shift at 6 in the morning, an hour earlier than usual to meet with Dr. Michael Chen for orientation. The emergency department had a different energy at this hour, quieter but with an underlying tension, like a coiled spring waiting to be released. The night shift was wrapping up their cases, and Maria could see the fatigue in their faces as they prepared to hand over responsibility to the day team. Dr. Chen was waiting for her in the trauma conference room, a compact space lined with medical reference books and equipped with a large monitor for reviewing case studies. He was a man in his early 40s, with graying temples and intense dark eyes that seemed to miss nothing. His reputation throughout the hospital was legendary. He had trained at Johns Hopkins and had worked in some of the busiest trauma centers in the country before coming to St. Mary's 5 years ago. "Maria Santos," he said, standing up as she entered the room. "I've heard good things about your work yesterday. Have a seat." Maria sat down across from him, trying to project confidence despite the butterflies in her stomach. Working directly with the chief of emergency medicine felt surreal after being on the job for less than a year. "Before we begin," Dr. Chen continued, "I want you to understand what you're getting into. The trauma team sees the worst cases that come through these doors. Multiple gunshot wounds, severe car accidents, industrial accidents, drug overdoses, suicide attempts, child abuse cases, domestic violence. We see humanity at its most vulnerable, and we see people on the worst days of their lives." He paused, studying her face carefully. "Some nurses find this work emotionally overwhelming. Others become hardened to the point where they lose their compassion. The challenge is maintaining your empathy while developing the emotional resilience to function effectively in crisis situations. Do you think you can handle that balance?" Maria thought about his questions seriously. Yesterday had been intense, but she had found herself energized rather than overwhelmed by the challenges. "I think so, Dr. Chen. Yesterday taught me that I can stay calm under pressure while still caring about my patients. I want to help people when they need it most." "Good answer," Dr. Chen replied. "Now let me tell you what I expect from trauma team members. First, absolute competence in your clinical skills. When we're working on a patient with multiple trauma injuries, there's no time to think about basic procedures. They need to be automatic. Second, the ability to anticipate needs before they're voiced. A good trauma nurse can predict what a doctor will need next and have it ready. Third, emotional stability. I can't have team members who fall apart when we lose a patient or who become personally involved to the point where it affects their judgment." He opened a thick folder and pulled out several case studies. "I want you to review these cases from last month. Study the interventions, the timelines, the decision-making processes. We'll discuss them at the end of your shift today." For the next hour, Dr. Chen walked Maria through the trauma protocols, the equipment locations, and the communication procedures that were specific to trauma cases. She learned about the trauma alert system, which categorized incoming patients based on the severity of their injuries and the resources they would need. A level 1 trauma meant the patient had life-threatening injuries requiring immediate surgical intervention. Level 2 indicated serious but stable injuries. Level 3 was for patients who needed prompt medical attention but weren't in immediate danger of death. The key to trauma medicine, Dr. Chen explained, is systematic assessment and prioritization. You assess airway, breathing, circulation, neurological function, and exposure, the ABCDs of trauma care. You have to be able to identify the most life-threatening problems first and address them in order of priority. Their orientation was interrupted by the sharp sound of the trauma alert system. Level 1 trauma, ETA 5 minutes. Adult male, gunshot wound to the chest, patient conscious but in respiratory distress. Dr. Chen's entire demeanor changed instantly, shifting from teacher to battlefield commander. "This is it, Maria. Trauma Bay 1. Let's go." The next 5 minutes passed in a blur of activity. Maria helped prepare Trauma Bay 1, checking that all necessary equipment was present and functioning. She put on protective gear and positioned herself where Dr. Chen indicated, ready to assist but staying out of the way of the more experienced team members. When the ambulance crew burst through the doors, Maria got her first look at a real gunshot victim. Marcus Williams was a 28-year-old man who had been shot during an attempted robbery at his convenience store. The bullet had entered his right chest, and pink, frothy blood was coming from his mouth, a sign that his lung had been punctured. "Talk to me," Dr. Chen called out as the paramedics transferred Marcus to the trauma bed. "Single gunshot wound to the right chest," the lead paramedic reported. Diminished breath sounds on the right side, oxygen saturation dropping despite high-flow oxygen. Blood pressure 90/60 and falling. He's been conscious throughout transport but becoming increasingly anxious. Maria immediately began attaching monitors and taking vital signs while Dr. Rodriguez examined Marcus's chest. She could see the entry wound, a small hole surrounded by bruising, but there was no exit wound visible. "Marcus, can you hear me?" Dr. Chen asked, shining a light in the patient's eyes. "My name is Dr. Chen. You're at SC. Mary's hospital, and we're going to take care of you." Marcus tried to speak but could only produce a weak whisper mixed with bloody foam. His eyes were wide with fear and the understanding that he was in serious trouble. "Pneumothorax," Dr. Rodriguez announced after listening to Marcus's chest. "We need to decompress now." Maria had read about pneumothorax, a condition where air leaks from a damaged lung into the chest cavity, putting pressure on the heart and the other lung. If not treated immediately, it could be fatal. Dr. Chen was already preparing to insert a chest tube to relieve the pressure. "Maria, I need you to prepare the chest tube tray and set up suction." Maria's hands moved automatically, opening the sterile chest tube kit and arranging the instruments while connecting the suction device. She had practiced this procedure dozens of times in simulations, but doing it while a real person lay dying on the table felt completely different. As Dr. Chen made an incision between Marcus's ribs and inserted the chest tube, Maria held suction and helped guide the tube into position. Immediately, air and blood began rushing out of Marcus's chest, and his oxygen levels started to improve. "Better," Dr. Rodriguez said, monitoring Marcus's vital signs. "SAT's coming up to 94%. But their relief was short-lived. Marcus's blood pressure continued to drop, and his heart rate was climbing. Dr. Chen ordered blood work and a portable chest X-ray, but he was clearly concerned about internal bleeding. "Maria, type and cross-match for 6 units of blood," Dr. Chen instructed. "And get Theor on the phone. We're going to need to open his chest." As Maria made the phone calls and prepared blood samples, she could hear Dr. Chen explaining to Marcus what was happening. Despite the urgency of the situation, he took time to keep the patient informed and as comfortable as possible. "Marcus, we've fixed the problem with your lung, but you're still bleeding inside your chest. We need to take you to the operating room to find the source of the bleeding and stop it. You're going to go to sleep for the surgery, and when you wake up, you should feel much better." Marcus nodded weakly, his eyes starting to lose focus as blood loss affected his consciousness. "Am I going to die?" he whispered. "We're going to do everything we can to make sure that doesn't happen," Dr. Chen replied firmly. "You're young and strong, and you got here quickly. Those are all good things." The surgical team arrived within minutes, and Marcus was rushed to the operating room. As the trauma bay emptied, Maria found herself shaking slightly from the adrenaline rush. She had just participated in saving someone's life, someone who might have died if they hadn't acted quickly and competently. "How do you feel?" Dr. Chen asked, noticing her reaction. "Scared, excited, proud, all at the same time," Maria replied honestly. "That's normal. The fear keeps you sharp, the excitement keeps you motivated, and the pride is what you earn by doing good work under pressure. But don't get attached to outcomes you can't control. We did everything right for Marcus, but his survival depends on factors beyond our control now." The rest of the morning brought a steady stream of patients, each with their own stories and challenges. Maria treated a construction worker who had fallen from scaffolding, an elderly woman who had suffered a stroke, and a teenager who had overdosed on prescription medications. Each case taught her something new about emergency medicine and about herself. She learned that she could compartmentalize her emotions when necessary, focusing entirely on the medical needs of her patients while processing her feelings about their situations later. She discovered that her hands remained steady even in the most stressful situations, and that she could think clearly and logically even when surrounded by chaos. Around noon, they received word that Marcus Williams had survived his surgery. The surgical team had found and repaired the damaged blood vessel, and, while he would need several days in intensive care, his prognosis was good. "First save," Dr. Rodriguez said to Maria with a smile. "How does it feel?" "Amazing," Maria replied. "I keep thinking about how he was dying right there in front of us, and now he's going to go home to his family." "Don't romanticize it too much," Dr. Chen warned, though not unkindly. "For every Marcus Williams we save, we'll see cases where we can't do enough. The job requires you to give your best effort to every patient while accepting that medicine has limits." As if to illustrate his point, their next trauma alert was announced: Level 1 trauma, ETA 3 minutes. Pediatric patient, 6 years old, struck by vehicle, multiple injuries. Maria felt her stomach clench. Treating injured children was one of the aspects of trauma medicine she had been dreading. She had worked with Tommy the previous day, but his injuries, while serious, hadn't been immediately life-threatening. A 6-year-old struck by a car could have devastating injuries. The little girl's name was Emma Rodriguez, and she had been chasing a ball into the street when a delivery truck hit her. The paramedics brought her in unconscious, with obvious injuries to her head and leg, and possible internal injuries. Dr. Chen immediately took charge, directing the team through the primary assessment. Emma's airway was clear, but her breathing was shallow and her heart rate was dangerously fast. There was significant swelling around her right eye and temple, indicating a serious head injury. "Get me a head CT stat," Dr. Chen ordered. "And I want neurosurgery down here now." Maria found herself assigned to monitor Emma's vital signs and prepare medications while Dr. Rodriguez examined the little girl's other injuries. Emma's right leg was clearly broken, with the bone visible through the skin, but the head injury was the immediate concern. As they worked, Emma's parents arrived, having followed the ambulance to the hospital. Maria could hear them in the hallway, crying and demanding to know if their daughter was going to be okay. It was heartbreaking to listen to, but Maria had to focus on her patient. The head CT revealed significant brain swelling and bleeding. Dr. Chen's expression was grim as he reviewed the images with the neurosurgeon who had just arrived. "She needs emergency surgery to relieve the pressure on her brain," the neurosurgeon explained. "Every minute we delay increases the risk of permanent damage." As they prepared Emma for emergency transport to the operating room, Maria helped Dr. Chen explain the situation to her parents. It was one of the hardest conversations she had ever witnessed, watching two people learn that their child's life hung in the balance. Emma's father, a man in his 30s who worked as a mechanic, broke down completely when he heard the word surgery. "This is my fault," he kept saying. "I should have been watching her more carefully. She's always chasing that damn ball." "This is not your fault," Dr. Chen said firmly. "Accidents happen, and children are naturally curious and impulsive. Right now, we need to focus on getting Emma the help she needs." After Emma was taken to surgery, Maria helped clean up the trauma bay while trying to process what had just happened. The little girl's life was now in the hands of the neurosurgical team, and there was nothing more the emergency department could do except wait and hope. "Pediatric cases are the hardest," Dr. Rodriguez said, noticing Maria's subdued mood. "Adults understand risk and make choices that sometimes lead to injury. Children are just innocent victims of circumstances beyond their control." The afternoon brought several more cases, but Maria found it difficult to concentrate fully. Part of her mind was upstairs in the operating room with Emma Rodriguez, wondering if the little girl would survive and what kind of life she might have if she did. Around 4 o'clock, Dr. Chen approached her at the nurse's station. "I can see you're having trouble with the Rodriguez case," he said quietly. "Want to talk about it?" "I keep thinking about her parents," Maria replied. "The look on their faces when you explained about the brain injury. I have a niece who's about the same age, and I can't imagine going through what they're experiencing." "That empathy is what makes you a good nurse," Dr. Chen said. "But you can't carry the emotional weight of every patient, especially the ones where the outcomes are uncertain. You did excellent work today. Your clinical skills, your ability to work under pressure, your patient care, all of it was exactly what we need on the trauma team. But what if she doesn't make it? Then, we'll have done everything we could for her, and her parents will know that she received the best possible care. That's all we can control, Maria. The outcome is in other hands now. As her shift was ending, Maria stopped by the surgical waiting room to check on Emma's parents. They were still there, holding hands and staring at the wall, surrounded by relatives who had come to offer support. "Excuse me," Maria said quietly, approaching Emma's mother. "I'm Maria Santos. I was one of the nurses who took care of Emma when she first arrived." Emma's mother looked up with red, swollen eyes. "How is she?" "Nobody will tell us anything." "I don't have any updates on her surgery," Maria replied honestly. "But I wanted you to know that Emma was very brave when she was with us. Even though she was unconscious, we talked to her and let her know that her mommy and daddy were here and that we were taking very good care of her." Emma's mother began crying again, but she reached out and squeezed Maria's hand. "Thank you for caring about her. Thank you for treating her like she was your own child." As Maria left the hospital that evening, she carried the weight of the day's experiences with her. Marcus Williams was recovering well from his surgery, but Emma Rodriguez was still fighting for her life. In one day on the trauma team, she had seen both the best and worst possible outcomes. The drive home gave her time to reflect on Dr. Chen's words about carrying emotional weight. She realized that trauma nursing would require her to develop new coping mechanisms, ways to process the intense emotions that came with regularly witnessing human suffering while maintaining her ability to provide compassionate care. But, despite the emotional challenges, Maria knew that she had found her calling. The trauma team needed nurses who could remain calm under pressure, who could think clearly in chaotic situations, and who could provide both technical expertise and human compassion. Today had proven to herself and her colleagues that she possessed all of those qualities. Tomorrow would bring new patients, new challenges, and new opportunities to make a difference in people's lives during their darkest moments. Maria Santos was ready to face whatever came through the trauma bay doors. Maria Santos adjusted her stethoscope for the 100th time that morning, her hands trembling slightly as she walked through the corridors of St. Mary's Hospital in downtown Chicago. At 24 years old, she was the youngest nurse on the emergency department staff, and she felt every single day of that age difference. The other nurses had been working here for years, some for decades, and they moved through their shifts with the confident ease that only comes from experience. She had graduated from nursing school just 8 months ago, and this job at St. Mary's was her first real position in a major hospital. The pay was good, better than she had expected for a new graduate, but Maria was beginning to understand why. St. Mary's Emergency Department was located in one of the busiest and most challenging areas of the city. They saw everything here: gang violence, drug overdoses, domestic abuse cases, heart attacks, strokes, and accidents of every kind imaginable. Maria's supervisor, Janet Williams, was a stern woman in her 50s who had worked in emergency medicine for over 20 years. Janet had made it clear from day one that she expected excellence from everyone on her team, regardless of their experience level. There was no room for mistakes in the emergency department, she often said, because mistakes could cost lives. "Santos," Janet called out as Maria passed the nurse's station. "Room 7 needs vitals, and the patient in bed 12 is asking for pain medication. Make sure you check his chart first before you give him anything." Maria nodded quickly. "Yes, ma'am." She hurried toward room 7, checking the patient's chart on her tablet as she walked. John Morrison, 62 years old, came in with chest pain. His wife had brought him in after he complained of tightness in his chest while they were having breakfast. As she entered the room, Maria found Mr. Morrison sitting on the edge of the examination bed, his face pale and sweaty. His wife sat in the chair beside him, holding his hand and looking worried. "Good morning, Mr. Morrison," Maria said with a warm smile. "I'm Maria, and I'll be taking care of you today. How are you feeling right now?" "Not too good, honey," Mr. Morrison replied, his voice strained. "This chest pain just won't go away. It started about 2 hours ago, and it's getting worse." Maria began taking his vital signs, wrapping the blood pressure cuff around his arm. His blood pressure was elevated at 160/95, and his heart rate was rapid at 110 beats per minute. His temperature was normal, but his breathing seemed labored. "Mr. Morrison, can you describe the pain for me? Is it sharp, dull, burning? Does it feel like pressure?" "It feels like someone sitting on my chest," he said, placing his hand over his heart. "And it's moving down my left arm now too." Maria felt a chill run down her spine. These were classic symptoms of a heart attack. She had studied them extensively in nursing school, but seeing them in real life was different. She needed to act quickly, but she also needed to stay calm. "I'm going to get the doctor right away," she told Mr. Morrison and his wife. "Please try to stay as comfortable as possible. We're going to take very good care of you." She stepped out of the room and immediately looked for Dr. Peterson, the attending physician. She found him reviewing charts at the nurse's station. "Dr. Peterson, I need you to see the patient in room 7 immediately. John Morrison, 62 years old, presenting with chest pain that started 2 hours ago. He describes it as pressure, radiating down his left arm. Vitals show elevated blood pressure and tachycardia." Dr. Peterson looked up from his charts, his expression becoming serious. "EKG? Not yet, but I was about to request one." "Good thinking. Get the EKG machine to room 7 now, and prepare for a possible code." "I'll be right there." Maria's heart was pounding as she rushed to get the EKG machine. This was exactly the kind of situation that made her feel overwhelmed. She had never been the first person to identify a potential heart attack before, and the responsibility felt enormous. As she wheeled the EKG machine down the hallway, she noticed some of the other nurses watching her. Sarah Mitchell, who had been working at St. Mary's for 15 years, gave her a skeptical look. "Rookie's first heart attack," Sarah muttered to another nurse as Maria passed by. "Let's see if she can handle it." The comment stung, but Maria pushed it aside. She had work to do, and Mr. Morrison was counting on her. She set up the EKG machine quickly, placing the electrodes on Mr. Morrison's chest with steady hands despite her nervousness. "This will just take a minute, Mr. Morrison," she said softly. "The machine will record your heart's electrical activity so we can see what's happening." Dr. Peterson arrived just as the EKG was printing out. He took one look at the results and his expression became grave. "Definite ST elevation. We're looking at a STEMI. Maria, call the cardiac cath lab immediately and tell them we have a patient coming up. Also, get me 325 milligrams of aspirin, stat." Maria's hands were shaking slightly as she made the phone call to the cardiac catheterization lab, but her voice was steady. "This is Maria Santos from the emergency department. We have a 62-year-old male with an acute ST elevation myocardial infarction. Patient needs immediate cardiac catheterization." The voice on the other end was crisp and professional. "We'll have a team ready in 10 minutes. What's the patient's name and medical record number?" Maria provided the information quickly, then hung up and turned to prepare the aspirin. As she was drawing up the medication, she could hear Dr. Peterson explaining to Mr. Morrison and his wife what was happening. "Mr. Morrison, you're having a heart attack. One of the arteries that supplies blood to your heart muscle is blocked. We need to get you upstairs immediately so the cardiac team can open that artery and restore blood flow." Mrs. Morrison began to cry. "Is he going to be okay?" "We're going to do everything we can," Dr. Peterson assured her. "The good news is that we caught this early, thanks to your nurse Maria here. Her quick assessment and action are going to make a significant difference in your husband's recovery." Maria felt a rush of pride mixed with continued anxiety. She administered the aspirin to Mr. Morrison and helped prepare him for transport to the cardiac cath lab. As they waited for the transport team, she stayed with the family, monitoring Mr. Morrison's condition and providing reassurance. "Thank you, dear," Mrs. Morrison said, grasping Maria's hand. "You've been so wonderful. I can tell you really care." "It's my job to care," Maria replied, squeezing the older woman's hand gently. "Your husband is in excellent hands here. The cardiac team upstairs is one of the best in the city. When the transport team arrived, Maria helped transfer Mr. Morrison to the stretcher and provided a detailed report to the cardiac nurse who would be taking over his care. She watched as they wheeled him toward the elevator, Mrs. Morrison walking alongside holding her husband's hand. As Maria returned to the emergency department, she found Janet waiting for her at the nurse's station. Her supervisor's expression was unreadable. "Santos, walk with me," Janet said. They stepped into Janet's small office, and Maria's stomach dropped. She was sure she was about to be criticized for something she had done wrong. "Close the door," Janet instructed. Maria closed the door and turned around, preparing herself for the worst. "I want you to know that you handled that situation very well," Janet said, her stern expression softening slightly. "Your assessment was accurate, you followed proper protocols, and you communicated effectively with the physician. Mr. Morrison's chances of a full recovery are significantly better because of your quick thinking." Maria felt a wave of relief wash over her. "Thank you, Mrs. Williams. I was worried I might have missed something or made a mistake." "Being worried about making mistakes is good," Janet replied. "It means you take this job seriously. But don't let that worry paralyze you. You have good instincts, and you need to trust them. However, I also want you to understand that what happened today was just the beginning. Working in emergency medicine means facing situations like this regularly, often several times in a single shift. Are you prepared for that?" Maria thought about the question seriously. The adrenaline rush of the last hour had been intense, both terrifying and exhilarating. The thought of facing similar situations regularly was daunting, but also somehow appealing. She had felt truly useful today, like she was making a real difference in someone's life. "Yes, ma'am. I think I am." "Good. Because your shift isn't over yet, and we're about to get busy. There's been a multi-vehicle accident on the interstate, and we're expecting multiple casualties within the next 20 minutes. Maria's eyes widened. "How many casualties?" "At least 6, possibly more. Mix of adults and children, various injuries. This is going to be all hands on deck, Santos. You up for it?" The question hung in the air for a moment. Maria could feel her heart rate increasing again, but this time it wasn't just from nervousness. There was excitement there too, the thrill of being needed, of having the skills to help people in their darkest moments. "I'm ready," she said with more confidence than she felt. "All right then. Let's go save some lives." As they left Janet's office, Maria could hear the distant wail of sirens growing louder. She took a deep breath and squared her shoulders. 8 months ago, she had been a nursing student practicing on mannequins. Today, she had helped save a man's life, and now she was about to face her biggest challenge yet. The automatic doors of the emergency department burst open as the first ambulance arrived. 2 paramedics rushed in with a patient on a stretcher, calling out vital signs and injury information as they moved. Maria grabbed a trauma gown and gloves, her earlier nervousness replaced by focused determination. "Trauma Bay 2, Dr. Peterson called out. Maria, you're with me." As Maria hurried toward Trauma Bay 2, she caught sight of Sarah Mitchell watching her with a different expression now. The skepticism was still there, but there was something else too. Maybe it was respect, or at least the possibility of respect. The patient was a young woman, probably in her 20s, with obvious injuries to her left leg and possible internal trauma. As the paramedics transferred her to the hospital bed, Maria immediately began attaching monitoring equipment and taking vital signs. "What's her name?" Maria asked the paramedic. "Jessica Turner, 23 years old. Driver of the vehicle that was rear-ended. Complaining of severe pain in her left leg and abdomen. Lost consciousness briefly at the scene but was alert during transport." Maria looked down at Jessica, who was conscious but clearly in significant pain. "Hi Jessica, I'm Maria, and I'm going to be taking care of you. You're at St. Mary's Hospital, and you're safe now." Jessica's eyes were wide with fear and pain. "My leg. I can't feel my leg. Is it still there?" Please tell me it's still there. Maria looked at Jessica's left leg, which was clearly broken but still attached. Your leg is there, Jessica. You have a fracture, but you're going to be okay. We're going to take very good care of you. As Dr. Peterson began his examination, Maria continued to monitor Jessica's vital signs and provide comfort. She could hear more ambulances arriving outside, bringing in the other victims from the accident. The emergency department was about to become a carefully controlled chaos, with multiple trauma teams working simultaneously to save lives. This was what she had signed up for when she decided to become a nurse, Maria realized. Not the quiet, predictable routine she had sometimes imagined, but this intense, demanding, life-and-death work where every decision mattered and every action could mean the difference between life and death for another human being. As she worked alongside Dr. Peterson to stabilize Jessica, Maria felt something shift inside her. The nervousness was still there, but it was manageable now. Underneath it was a growing confidence, a realization that she belonged here, that she had the skills and the heart for this work. The trauma bay doors opened again as another patient was brought in. The next few hours were going to test every skill she had learned and push her to her limits. But, for the first time since starting at St. Mary's, Maria Santos felt ready for the challenge. The emergency department transformed into a battlefield within minutes. 6 patients from the highway accident arrived in rapid succession, each presenting different challenges and levels of trauma. Maria found herself assigned to Trauma Bay 3 with Dr. Amanda Rodriguez, treating a 7-year-old boy named Tommy who had been a passenger in one of the vehicles. Tommy was conscious but crying hysterically for his mother, who was being treated in Trauma Bay 1 for her own injuries. The little boy had suffered a head injury and possible internal bleeding, making his case particularly delicate. Maria knelt beside the gurney so she could be at Tommy's eye level. Hi Tommy, my name is Maria, and I'm a nurse here. I know you're scared, and that's okay. We're going to take really good care of you, and we're going to help you feel better. Tommy's crying subsided slightly as he looked at Maria with wide, frightened eyes. I want my mommy. Where's my mommy? Your mommy is right here in the hospital with us, Maria said gently, carefully checking his pupils with a small flashlight. She's getting help from other doctors and nurses, just like you are. She told me to tell you that she loves you very much and that you're being very brave. It wasn't entirely true about his mother sending a message, but Maria knew that sometimes small lies were necessary to comfort a terrified child. Tommy's pupils were equal and reactive, which was a good sign, but Dr. Rodriguez wanted a CT scan to rule out any serious brain injury. As Maria prepared Tommy for transport to radiology, she noticed that his blood pressure was dropping slightly. She immediately alerted Dr. Rodriguez, who ordered additional blood work and a closer examination of Tommy's abdomen. Good catch, Maria, Dr. Rodriguez said quietly. We might be looking at internal bleeding. Let's get a fast scan before we send him to CT. The fast scan, which used ultrasound to check for internal bleeding, revealed fluid in Tommy's abdomen. Dr. Rodriguez's expression became grim. The boy needed surgery, and he needed it soon. Tommy, Maria said, holding his small hand as Dr. Rodriguez made phone calls to the surgical team, we need to take you to a special room where the doctors can fix what's hurt inside your tummy. You might feel sleepy during the operation, but when you wake up, you'll feel much better. Will you be there? Tommy asked, his voice small and scared. Maria felt her heart break a little. I wish I could be, sweetie, but I have to stay here to help other people who are hurt. But the doctors and nurses in the operating room are even better at fixing hurt tummies than I am. As the surgical team arrived to take Tommy upstairs, Maria gave him her brightest smile. I'll check on you after your operation, okay? And I'll make sure your mommy knows exactly where you are. After Tommy was wheeled away, Maria felt emotionally drained, but there was no time to process her feelings. Another ambulance was arriving, this one carrying an elderly man who had suffered a heart attack while driving, causing the accident in the first place. Maria was reassigned to assist Dr. Peterson with this new patient, Harold Fleming, who was 74 years old and in cardiac arrest. The paramedics were performing CPR as they rushed through the emergency department doors. How long has he been down? Dr. Peterson called out as they transferred Harold to the trauma bed. Approximately 15 minutes total, the lead paramedic responded. We got pulses back twice during transport but lost them again. Last rhythm was ventricular fibrillation. Maria immediately began attaching cardiac monitors while Dr. Peterson prepared to intubate. She had assisted with CPR during her training, but never on a real patient in such a critical situation. Her hands moved automatically, connecting leads and preparing medications, while her mind focused entirely on the task at hand. Charging to 200 joules, Dr. Peterson announced. Everyone clear. Maria stepped back as the defibrillator delivered its shock. Harold's body jerked, and everyone looked at the cardiac monitor. Still no organized rhythm. Resume CPR, Dr. Peterson ordered. Maria, push 1 milligram of epinephrine. Maria drew up the epinephrine quickly and administered it through Harold's foreline. She then returned to chest compressions, counting aloud as she pushed hard and fast on Harold's chest. She could feel his ribs flexing under her hands, and she hoped desperately that she wasn't causing more injury. After 2 minutes of CPR, they checked the rhythm again. This time, there was a weak but organized heartbeat on the monitor. Harold's pulse was thready but present. We got him back, Dr. Peterson said with relief. Let's get him stabilized and up to the cardiac unit. As they worked to stabilize Harold, Maria couldn't help but think about the chain of events that had led to this moment. Harold's heart attack had caused him to lose control of his car, resulting in the multi-vehicle accident that had injured 6 other people, including little Tommy. It was a stark reminder of how quickly lives could change and how interconnected human experiences could be. Once Harold was stable enough for transport, Maria finally had a moment to check on how the other patients from the accident were doing. Jessica Turner, the young woman with the broken leg, was being prepared for orthopedic surgery. 2 other patients had been treated and released with minor injuries. Tommy's mother had suffered several broken ribs but was stable and conscious. Maria went to visit Tommy's mother, Sarah, who was lying in bed anxiously asking every nurse who passed by about her son's condition. Mrs. Peterson? Maria approached the bed with a gentle smile. I'm Maria Santos. I took care of Tommy when he first arrived. Sarah's eyes immediately filled with hope and fear. How is he? Please tell me he's okay. Nobody will tell me anything, and I'm going crazy lying here. Tommy was very brave, Maria said, sitting in the chair beside Sarah's bed. He has some internal injuries that require surgery, but he's in excellent hands. The pediatric surgical team here is one of the best in the region. He's in surgery now, and the doctor said he expects Tommy to make a full recovery. Sarah began to cry, tears of relief mixed with continued worry. He was so scared in the car after the accident. He kept calling for me, and I couldn't get to him because my seatbelt was stuck. I felt so helpless. You did everything right, Maria assured her. You kept him calm until help arrived, and that made our job much easier when he got here. Tommy was asking about you too. He's worried about his mommy, so when you're feeling up to it, maybe we can arrange for you to see him. As Maria sat with Sarah, offering comfort and answering her questions, she realized that this aspect of nursing was just as important as the technical skills. Being able to provide emotional support to families in crisis was a crucial part of the job that couldn't be learned from textbooks. Later that evening, as the chaos from the accident finally began to subside, Maria found herself assigned to check on the patients who had been admitted to various units throughout the hospital. It was a quiet task that gave her time to reflect on the day's events. She stopped by the cardiac unit to check on Mr. Morrison, the man who had come in that morning with chest pain. The cardiac catheterization had been successful, and he was resting comfortably with his wife at his bedside. There's our angel, Mrs. Morrison said with a warm smile when she saw Maria enter the room. John was just asking about you. The doctor said you probably saved his life by recognizing what was happening so quickly. Mr. Morrison looked much better than he had that morning, with color back in his cheeks and his breathing no longer labored. I can't thank you enough, Maria. If you hadn't acted so fast. I'm just glad I could help, Maria replied, checking his monitors and noting that his vital signs were stable. "How are you feeling now?" "Like a new man, Mr. Morrison said. The doctor said the blockage was 95%, and if we had waited much longer, I might have had permanent damage to my heart muscle." Maria spent a few more minutes with the Morrisons, answering their questions about his recovery and discharge plans. As she left their room, she felt a deep sense of satisfaction. This was why she had become a nurse, to make a real difference in people's lives. Her next stop was the pediatric unit to check on Tommy. She found him awake in his room, with his mother sitting beside his bed. The surgery had been successful, and his internal bleeding had been repaired without complications. "Maria!" Tommy exclaimed when he saw her, his face lighting up despite the bandages and 4 lines. "You came to see me?" "Of course I did," Maria said, approaching his bed with a smile. "I promised I would check on you. How are you feeling, brave boy?" "My tummy hurts, but not as much as before," Tommy said. "And, look, Mommy's here." Sarah reached out and squeezed Maria's hand. "I can't thank you enough for taking such good care of him. The surgeon said you caught the internal bleeding early, which made the surgery much easier." As Maria talked with Tommy and his mother, she felt the same sense of fulfillment she had experienced with the Morrisons. Despite the chaos and stress of the day, she had played a role in helping multiple families through their darkest moments. When she finally returned to the emergency department to finish her shift, Maria was exhausted but oddly energized. Janet was completing paperwork at the nurse's station when Maria approached to give her report on the admitted patients. "How are you holding up, Santos?" Janet asked, looking up from her charts. "Tired, but good," Maria replied honestly. "Today was intense, but I feel like I learned so much." "You did more than learn," Janet said, her expression serious but not unkind. "You proved that you belong here. I've been doing this for 20 years, and I've seen a lot of new nurses come and go. Some of them crack under pressure, some of them freeze up when things get complicated, and some of them just don't have the instincts for emergency medicine. You handled everything that was thrown at you today with skill and compassion." Maria felt a warm glow of pride at the praise, but Janet wasn't finished. However, Janet continued, "Today was just one day. Emergency nursing isn't about having one good day, it's about consistently performing at this level, shift after shift, even when you're tired, even when you're dealing with difficult patients or families, even when you're facing situations you've never encountered before." "I understand," Maria said. "I know today was just the beginning." "Good. Because tomorrow you're going to be assigned to the trauma team rotation. Dr. Peterson specifically requested you after seeing how you handled today's cases. It's unusual for a nurse with less than a year of experience to be assigned to trauma, but you've shown you can handle the pressure." Maria's eyes widened. The trauma team was considered the elite unit of the emergency department, handling the most critical cases that came through the doors. Being assigned to trauma as a new nurse was almost unheard of. "Are you sure I'm ready for that?" Maria asked, suddenly, feeling nervous again. "Ready or not, you're going to find out," Janet replied with what might have been the ghost of a smile. The trauma team works different shifts, 12 hours on, 24 off. You'll be working with Dr. Rodriguez, Dr. Peterson, and Dr. Michael Chen, our Chief of Emergency Medicine. They don't accept anything less than excellence, and they won't make allowances for your inexperience. As Maria walked to her car after her shift ended, she reflected on how much her life had changed in just one day. She had started the morning as an uncertain new nurse, worried about making mistakes and wondering if she was cut out for emergency medicine. She was ending the day as a member of the trauma team, with new responsibilities and challenges ahead. The drive home through the city streets gave her time to process everything that had happened. She thought about Mr. Morrison and how his quick treatment had prevented permanent heart damage. She remembered Tommy's frightened face and how his successful surgery would allow him to grow up healthy and whole. She considered Harold Fleming, whose life they had managed to save despite his cardiac arrest. Each case had presented its own challenges and required different skills. With Mr. Morrison, it had been about recognizing symptoms and acting quickly. With Tommy, it had required both clinical skills and the ability to comfort a scared child. With Harold, it had demanded technical expertise in emergency cardiac care. Maria realized that emergency nursing wasn't just about medical knowledge or technical skills, though both were crucial. It was about being able to adapt quickly to changing situations, to think clearly under pressure, and to provide both clinical excellence and human compassion simultaneously. As she pulled into her apartment building's parking lot, Maria felt a mix of exhaustion and anticipation. Tomorrow would bring new challenges, new patients, and new opportunities to make a difference. The trauma team rotation would test her skills in ways she couldn't even imagine yet. But, for the first time since starting at St. Mary's, she felt truly confident that she belonged there. She had proven to herself, to her colleagues, and to her supervisor that she had what it took to be an emergency nurse. The nervousness was still there, but it was balanced now by excitement and determination. Maria Santos was ready for whatever tomorrow would bring.